So on the day of surgery, you come into the clinic and we do a pre-op discussion and assessment before starting surgery. So you go through a consent form and you'd be given the opportunity to ask anything, obviously, before starting. We get you changed into a surgical scrub top, and then you come down into the theatres. And at that stage, we'd ask you a few questions to go over your background again, your medical history, medications, allergies, those sorts of things. Check your blood pressure, and then we, perhaps depending on what the plan was, mark out the areas that we're going to do surgery in. So we'd draw and design the hairline and map out the areas on the top of the head that we're going to do the surgery on. And then it comes down to shaving. So, each case is different. We may need to do a full head shave or a part shave. And then from that stage, we start surgery. So you're given an opportunity to take your time at that stage. If you need a toilet, if you need a drink, you have that opportunity before we start. And then we go into the surgery when you're ready. So we localize, we use local anesthetic to numb the area. We wash everything down. And then it depends on the plan for the patient. So we may do the incisions first, which is where we do small holes in the top of the head, the recipient area. And these are the holes that your hairs are going to be placed into. Sometimes we do the extraction first, and that's when we take out the hairs from the back of the head. But we'll discuss that plan with you prior to surgery so you know what's coming up.